Hi, my name is Michael Weiss. I'm a fourth-year pharmacy student from Creighton that's been working with Dr. Lori Hayes up in the prescription assistance program for the past 4 weeks. And today I'm just going to be talking to y'all about some dietary supplements and things that might be useful for you in clinic, or if patients ever ask any questions about some things they might be taking. So some objectives I have here are defining what the FDA considers to be a dietary supplement and some important regulations pertaining to them, looking at different organizations that test supplements for quality and purity, identifying any possible indications for some commonly used supplements, understanding different toxicities and interactions that exist with many of them out there, and then lastly, recognizing drugs that may cause some nutrient deficiencies. So supplements are pretty much everywhere. You see commercials for them on TV, pop-up ads on the internet, they're on billboards, they're in the pharmacy, they're in the grocery store. And almost everybody has taken one before, whether that be just a multivitamin, a vitamin C supplement, vitamin D. It's a $30 billion industry each year here in the United States, according to the National Institute of Health. And with that, there's a lot of trust and faith in that industry by consumers and patients. So patients expect to, when they buy, for example, a vitamin C supplement, it has the correct amount that the bottle says is in it. It doesn't have anything else that's going to make them sick. And many patients don't consider these to be what they call medications. They say, oh, it's all natural, but that always isn't necessarily the case. There are a lot of supplements out there that can cause very severe adverse drug reactions and can interact with a lot of the medications they're currently taking. So that's why it's very important to get a full medication history when talking with patients and asking, in addition to your prescription drugs, is there anything that you're currently taking over the counter or any supplements that you're currently taking? So what exactly are dietary supplements? Well, the FDA defines them under the Dietary Supplement Health and Education Act of 1994. And they say they're a product intended to supplement the diet that contains one or more dietary ingredients, including vitamins and minerals, herbs or botanical products, amino acids, enzyme supplements, and there are many more out there that are classified as a dietary supplement. And the FDA says that these must meet what they call current good manufacturing practices. So these are standards that the FDA sets for quality and purity when manufacturing products. The FDA also requires specific labeling to be placed on these products. And so the label must contain the word dietary supplement or vitamin D supplement, vitamin C supplement. Just that word needs to be on the label somewhere. Additionally, they need a supplemental facts area, just like you'd see on any nutrition facts label. So you have your serving size, your ingredients, the amount per serving, percentage daily value as seen here on the graphic on the right. Additionally, there are a lot of products out there that are considered proprietary blends where the manufacturer doesn't want to disclose in fear of competitors using their recipe exactly what's in their products. And so the FDA does allow those manufacturers just to list the ingredients and not the amount of each one. They just need to do it from largest to smallest amount. Also, if there's any safety information that the FDA considers material to the consequences that may result from the use of the product, that also needs to be placed on the label. So if a certain supplement is really dangerous to patients who have liver issues, then that needs to be included on the bottle. If any structure or function claim is made, the label must read, "This statement is not evaluated by the FDA. This product is not intended to cure, treat, or prevent any disease." So, for example, if a supplement says supports bone health or boosts immune system, like for example, Emergency says that, then that statement needs to be on the bottle somewhere. So with this, a lot of manufacturers can get away with saying things that may not always necessarily be true. So that's something that patients need to do a little research on and look at what exactly they're taking and if there really is any evidence at all behind it. And lastly, the burden is really on the FDA to demonstrate harm with these supplements. And so it's almost a complete 180 from how the FDA handles prescription medications. So instead of having to prove safety and efficacy beforehand, supplement manufacturers don't have to. Like I said earlier, the FDA, the burden is on them to demonstrate any harm with these products. But companies are required, though, to keep records of any adverse effects that patients report to them, and they also need to report those to the FDA. But really, for example, if I wanted to just start making my own vitamin supplement in my basement, I could, as long as I followed good manufacturing practices. And the FDA could only stop me if at some point customers or patients were reporting that their product was making them really sick, or there were reports of deaths from using my product. So there really is a lot of leeway that the FDA gives to these manufacturers, and it's a lot more of a reactionary approach rather than a precautionary approach. So if a patient asks you, is this brand of, vitamin C okay to take, or is this going to hurt me in any way? Does this have in it what it says it has in it? Well, there are several independent organizations that accredit supplements. All these organizations here will actually buy them over the counter and test them several times a year. Of course, they can't test everything that's out there, but they test a lot of things. And they are NSF International, Underwriters Laboratory, Consumer Labs, and USP, or the United States Pharmacopoeia. And like I said, they test these products several times a year. All the results are posted on their website, so customers can actually go on there and look for their specific brand of the product they're taking. And a lot of these organizations allow manufacturers to place their logo on the bottle if they have been approved. So for example, Nature Made products have the USP verified logo on the bottle, showing that, hey, an independent organization has reviewed our supplement and they say it's in par with where it should be. So the next couple slides here are about some common uses of supplements that you might see patients using. This is by no means an exhaustive list, and I'm not necessarily saying for sure if something is really effective or not. It's just what you actually might see patients actually using. So for anxiety, valerian and passion flower are common things you might see. L-lysine is used with cold sores, and I'm sure y'all have seen anything and everything used for the cold and the flu, but echinacea, zinc, and vitamin C are some things that patients take frequently. For dementia and memory, ginkgo and vitamin E are two common ones. For depression, St. John's wort is something that you may see patients taking, and there is some evidence out there showing good efficacy with it. But with this, there comes a lot of potential adverse effects and drug interactions that we'll get to here in a little bit. For high cholesterol, you see red yeast rice and niacin. The niacin supplement that's over the counter is actually very similar to the prescription medication. The only difference is that the prescription is more of an extended release formulation to eliminate the flushing that you do see with niacin as a supplement over the counter. For dyspepsia, you see calcium, magnesium like you would in Tums. The supplements out there for energy and weight loss are meant to increase the body's metabolism and sympathetic nervous system. And so those that you see out there are bitter orange and caffeine, in addition to several others. For heart health, CoQ10 is commonly used. For IBD, you see fibers like you would with Metamucil and probiotics. For insomnia, melatonin, of course, is commonly actually prescribed by physicians for patients to use for sleep. Valerian is also sometimes seen. For menopause, some patients will use black cohosh tablets. For migraine prevention, a lot of neurologists will actually ask patients to take feverfew, butterbur, or magnesium to help prevent their migraines in addition to another prescription preventative. For osteoarthritis, glucosamine sulfate is actually been shown to be very effective, and if patients are on glucosamine, it's important to make sure they are on the sulfate version, as this has actually been the only one shown to have any efficacy For osteoporosis, of course, patients a lot of times are on calcium and vitamin D. And I'm not going to go over every single little thing here on this list, but it just gives you a good idea of how extensive the market is out there for supplements to be used in common things that we see patients with every day. And the next couple slides here discuss different supplement interactions and toxicities that a lot of supplements out there might have. So St. John's wort, the use of it is strongly discouraged within the medical community just because of so many adverse events and interactions that might take place. So it induces several enzymes that break down medications. And so if you are on an oral contraceptive or warfarin, you can actually see decreased efficacy with these medications because this St. John's wort actually increases the metabolism of them, so they're less effective. Additionally, with triptans and MAOIs and SSRIs, you can get some serotonin syndrome going on. There's also photosensitivity. With St. John's wort, it can actually lower the seizure threshold in patients. So especially in patients who have seizures or other comorbid conditions and are taking a lot of medications, its use is really strongly discouraged. Chelation and binding is also something that can happen between supplements that patients take and medications that they're currently taking. And this occurs through binding of the medication with either a heavy metal, supplements, or actually sometimes food that patients take. So this is very important with tetracyclines like doxycycline or fluoroquinolones such as Cipro and your thyroid medications. And what happens here is, for example, if a patient is taking an iron supplement and they take it with their Synthroid medication, that actually can bind together in the stomach and prevent both the iron and your levothyroxine from properly absorbing. So that's why it's very important to take the medications listed here on an empty stomach, either 1 hour before you're going to take your supplement, such as iron, or 4 hours after you take your supplements or eat. Calcium, which is seen in, of course, milk and cheeses and yogurt, also has the potential to bind with these medications. So it's very important to make sure you're spacing those out. Increased bleeding is also another potential interaction that can occur with several supplements out there. The most common ones are considered the 5 Gs, so garlic, ginger, ginkgo, ginseng, and glucosamine. Fish oil is also another one. Willow bark is pretty much a natural version of aspirin, so that is also needs to be watched carefully if a patient is already taking aspirin. And as you can see, there are several more here listed, and like I said, this is not an inclusive list, but things that you see patients taking and they are on NSAIDs already, or Eliquis, Pradaxa, warfarin, Lovenox, and they are seeing increased bruising or bleeding. This might be a potential factor in that, and something that needs to be talked about with the patient and watched out for. Liver toxicity is also something that can happen with a few different supplements out there. Black cohosh and kava are two of the kind of the biggest ones that are well known within the medical community. Both these, there actually have been case reports out there of liver failure and actually patients needing transplants or passing away because of both these supplements. It's really important, especially to avoid these in general, but especially in patients with liver impairment or patients who are alcoholics, as this can really stress their liver out and potentially cause liver failure. Cardiac toxicity is the last one I'm going to be talking about here. And as mentioned earlier, a lot of the weight loss products have the potential for this because they do speed up the body's metabolism and activate the sympathetic nervous system. And so bitter orange and caffeine are two of the most common things seen in several weight loss supplements. And so if a patient's already drinking a liter of Coke a day and they're on either a caffeine weight loss supplement or they're using caffeine powder, as seen here in the bottom right, and that can potentially lead to very severe cardiac issues. Ephedra is used to be seen in several weight loss products and has since been removed from the market for several years, but is actually still being found in trace amounts and in several weight loss supplements out there. Manufacturers are kind of sneaking them in, and that was actually specifically removed due to very severe cardiac issues that can be happening with patients. So it's important to counsel patients to avoid these if they have very severe hypertension, heart failure, a history of arrhythmias, or myocardial infarction. And so the last slide here talks about different medications that may be causing nutrient depletions. So, of course, people who are chronic alcohol users have thiamine and vitamin B6 deficiencies. With warfarin, of course, you got lower amounts of vitamin K in the body and vitamin E. Diuretics, for example, have a lot of different nutrient and vitamin deficiencies that might be happening just due to their mechanism of action. They're eliminating water, and with water comes electrolytes. And so potassium, of course, is something that is actually used as a prescription for patients who are on loop diuretics like Lasix or furosemide. Thiazide diuretics actually have the potential to increase the amounts of calcium in the body. And so patients who do have osteoporosis, it actually might be something that is a little bit of a positive of them using a thiazide diuretic. With metformin, you see folate and vitamin B12 deficiencies. One thing I don't have on here, which has kind of become a new buzz thing in the medical community, and especially in pharmacy at least, is with proton pump inhibitors. So your Nexium, your omeprazole. There's evidence out there showing decreased absorption of magnesium and vitamin B in food. And so patients are actually developing deficiencies on some PPIs. And so supplementing with your vitamin B or magnesium may be important for these patients if they are unable to get off a PPI at that time. And like I said earlier too, this is not anywhere near an inclusive list, but just kind of gives you an idea of how a lot of medications out there may be causing nutrient depletions, and patients might be taking supplements to make up for that. So in summary, like I said earlier, supplements are everywhere. They're in our grocery store, TV, they're everywhere. And with that though, a lot of people are taking them, and they don't always realize that their supplements they're taking interact with the medications they're on, and they really aren't without their own risks. And so it's very important to get a full medication history from patients so we can get a full picture of exactly what's going on with them and prevent any sort of adverse reactions that might occur. So if you have any questions, feel free to email me at michaelweiss@creighton.edu. I'm by no means a big expert on this topic, but if you have any questions, I'm always happy to help out. And thank you for listening to my presentation today.